Hello, once again, welcome to MS Veterinary Center YouTube channel. This is Vet Sanon from MS Veterinary Services, where we offer dedicated expert care for all your animals' needs. In today's video, we are going to talk about another tick-borne disease, babesiosis, red water, or tick fever. Babesiosis is a protozoan disease affecting mainly the red blood cells, and it is more prevalent in adult cattle as compared to the young cattle. It should be noted that the indigenous breeds of cattle are more resistant to babesiosis than the exotic ones. Babesiosis is caused by the Babesia parasite, and in bovine it is caused by two major species, that is Babesia bigemina and then Babesia bovis. These are vectored by the Bufila species of ticks, and transmission occurs when the larvae of infected tick feed on the host for the case of Babesia bovis, while Babesia bigemina occurs when nymphs and adults of infected ticks feed on the host. It should be noted that the rate of tick transmission is generally higher for Babesia bigemina than Babesia bovis. The clinical signs for babesiosis include anemia, anorexia, jaundice, stray coat, increased respiratory rate, diarrhea, dullness, weight loss, then hemoglobinemia and hemoglobinuria, which occurs in the final stages. And by the time I attended to this animal, it was already in the final stages, and I found hemoglobinuria as you see it in the video. And for the cows in the late term pregnancy may abort, and temporary infertility may be seen in bulls due to transient fever. So this is a swift disease. It needs to be handled as early as possible, and the farmers, I advise you to always be critical on these animals. Always check for signs of disease in these animals. Any weakness, you should always report to the nearest veterinary officer. In diagnosis, we majorly base on history and clinical signs such as coffee-colored urine and presence of ectoparasites like the ticks on the animals. As this one here, I found several ticks on it, and even the coffee-colored urine as you see it in the video. But we also carry out confirmatory diagnosis by microscopic examination of the blood smears from suspected animals. In differential diagnosis, we can have filariasis, but here the lymph nodes are enlarged, and it mostly affects the white blood cells, and anemia is not a clinical sign, so we confirm the above. We can still have anaplasmosis, but hemoglobinuria does not occur in anaplasmosis, and the organism can be confirmed by microscopic examination. In addition is trypanosomiasis, but swelling of lymph nodes is an important sign, along with the formation of localized inflammations on the skin for the case of trypanosomiasis, which doesn't exist in babesiosis. In the treatment part, we normally use imidacloprid dipropionate and diminazine acetate. Then we can give symptomatic treatment due to severe anemia using iron solution and then mineral. Spraying is a preventive measure which I normally encourage my farmers to practice. Thank you for watching, but don't forget to subscribe, like and share.